The gift of care. Questions to ask and when. There's an endless list of questions you might ask doctors, nurses, home care coordinators, social workers, community agencies, and the list goes on. We will cover some of the most important to get started, but there's also a handout with more detailed questions to help you. Your own questions, of course, are the most important. Before you ask questions, you need to start a notebook or a binder to keep track of the W5, the who, what, where, when, why, and how of all the questions that you will ask. These records will include who you talk to, their contact information to follow up conversations either by telephone or email or other formats, what you talked about, where you were for the conversation, at home, in their office, at the bedside, when you talked to them, the date and time, why it was important to have the conversation, and how you resolved whatever the issue was. Part of this record includes a list of questions you will ask and the answers you receive. And in doing that, you may be the only person who's actually keeping track of the whole healthcare journey for your loved one. When you're making an appointment, you don't need much information other than contact information when you called, when the appointment is. When you have an actual conversation, however, you need more details because you may need it in a month from now or several months from now. Without a record, you will forget most of what you discussed and agreed upon. And again, as I say, often the other person you're speaking to will have very limited records themselves. There are categories of questions. There are questions that doctors need you to answer first of all before you begin questioning them. So they want to know what concerns you or your loved one about your condition today, what is the history that led up to the appointment today, where in the body did the pain and symptom begin. These are just the preliminary questions a doctor may ask. Depending on your history with the doctor, whether it's a family doctor who knows your medical history or a new specialist, you may need to give the answer to several people before they can diagnose the problem. A thorough medical history can take several hours, but usually you only have about 6 minutes for a regular appointment. So come prepared to answer the most important questions concisely so that you can get to your own questions. Categories of questions. There are different categories and we'll go through each one. This one is a category of tests. You will often be referred for tests, and here are some of the questions to ask before you agree to them. What is the purpose of this or these tests? What do you expect to learn, and will the results change my treatment? If not, do I really need to take the test? And if it does, how might it change my treatment? What happens if I don't have the test? And what will the test feel like? What are some of the risks? Other questions may include things like, can you be in the room with your loved one during the test? If not, why not? Can your loved one go home or go to work afterwards? When will they and you get the results? Can you call whether the results are positive or negative? Sometimes doctors only call if they are negative results. Since you don't know when they will call, you really don't know what the results are positive or negative or not, and keep waiting for a possible negative phone call from your physician. What are false positive rates for this test is another question that you might ask. Categories of questions around drugs. You may be prescribed medications, and some questions you might ask include, how quickly do I come to you if I don't feel right after taking the drugs? What happens if I don't take this medication? And what are the alternatives to these drugs? Of course, these are questions your loved one may ask or you may ask on their behalf. Your pharmacist will typically go over the W5 plus H of medication with you, how they will react with your other medications, what the goal of the medication is in your treatment, how long you should be taking it, etc. Asking your physician is also helpful to compare their answers with those of the pharmacist. Pharmacists have the most information, of course, around medications, but your physician will have specific knowledge specific to your situation. There's also a website called drugs.com that is a good resource to check some of the information for yourself. Don't rely on it, but use it as a resource. When your loved one checks about their, asks questions about their condition, or again, you asking the questions for them, about the diagnosis. What do I have? How did I get it? Can I prevent it recurring? Is my family at risk? What is the condition? How do we treat it? And what are alternatives to treatment? Those are the core questions you would ask about a condition. The prognosis is what the physician expects will happen with your condition or disease. What is the expected outcome? Is there a cure? Is this a chronic condition? Is this a terminal condition? Are there alternative outcomes as opposed to just one? And what are the long-term side effects, pain, and symptoms of this particular condition? Before going to hospital, you will want to know who's in charge of your overall care there. Is it your family physician, which is very unlikely, or is it your specialist who has asked you to go to the hospital for either tests or treatment? And how do you reach them, especially in after hours and on weekends if something should go wrong? In teaching hospitals that are aligned with a university that has a medical school or nursing school or social work school, you're allowed to refuse tests or exams that are just for the education of students. Sometimes you just may be too exhausted to go through extra exams in order to help students learn. And other times you might be excited to be helpful in the education of our future doctors, nurses, social workers, and others. Who does my family go to with questions is a core question. You want a list of contact information, especially, again, as I say, in evenings and on weekends. Questions you might ask before surgery. What are the risks and benefits of this surgery? And are there alternatives? And what are their risks and benefits? The prognosis if you don't consent to the surgery. Some surgeries may not change your prognosis dramatically enough for you to go through it. Others may have a huge impact. You need to know that. What's the specific surgeon's success rate with this specific surgery? What is the expected pain and discomfort afterwards, and how will we cope with them? And what do my family need to know to prepare to care for me at home once I return home from the surgery? Surgery is scary enough for most people. Some patients prefer lots of information, and others prefer little. Family caregivers may need to know more to prepare for post-surgery care, and sometimes they may not be ready to hear it until quite a few days after the surgery. Timing is important. You don't have to know everything all at once. You can shift it, divide it over a number of days. Questions about discharge planning, about moving from the hospital back home. Discharge planning is critical to successful recovery from treatment and surgery. And the hospital typically has someone who coordinates that discharge with your loved one so they can receive some home care if necessary. An effective healthcare system tries to prevent your loved one from returning to the hospital with an emergency. However, that does happen, and you need to be prepared for either an emergency readmission to hospital or having contact information for doctors and nurses so that they can answer your questions by telephone rather than you rushing to the emergency room. So some questions on discharge. How do I ensure that home care starts the day they leave hospital? I hear horror stories about having to wait days for medications or for nursing, and so how do we prevent this? Who do I contact at home care specifically? Again, especially after hours on weekends. What equipment and supplies are provided by home care, and what do I need to buy before my loved one returns home? And who do I call if I'm overwhelmed? Other places where you can find information about home care in your community can include asking the discharge planner at the hospital for any resources, brochures, websites that they recommend, your own search for websites of your community and regional healthcare system, and consumer groups. People who've gone through whatever this particular situation is before are a wealth of information of the types of questions to ask, when to ask them, who to ask them of. Is it better to ask the doctor, the pharmacist, the nurse, that sort of thing. And consumer groups, of course. Summary, the questions to ask. Keep in mind that there's a document attached to this module with a much more detailed list of questions. But the basic core of questions is making sure that you keep records very clearly and that you understand the categories of doctors, tests, drugs, about the condition, about the prognosis, going to hospital, about surgery, and discharge planning. The next module looks at how to create your own support team, and this is especially true for people who have long-term care needs. We'll be back soon.